Hello, this is Dr. Gretchen Kubacki, and I wanted to talk to you today about the difference between grief in adults and young adults. And by young adults, I mean anyone who's a teenager all the way on up into their 20s. And what's different, of course, is you've probably heard the teenage brain is not fully developed. That is certainly true. And it does affect how grieving works in teenagers and young adults. So the difference is that there's a lot going on hormonally still. Teenagers with their raging hormones, young adults who are horny all the time, confused by sex and love, and also dealing with a lot of social and peer pressure, trying to figure out who they are as adults. Things like drugs, alcohol, partying, the dating scene, where to go to school, whether or not to go to grad school, what kind of job you might be able to get, how are you going to make it in this world financially. All of those things are huge stressors. And so, what happens when grief is thrown into the mix is that it often becomes this really overwhelming thing. And a lot of times, it's something that gets suppressed. You put it away because you're in the middle of a semester or you've just got to get through the year or whatever it is. And so, adults who are older, adults, can help a lot by offering some guidance and some support and by making suggestions, not offering orders, but by pointing a teenager or a young adult to resources on the web, to a grief group, or ultimately to someone like me, a certified bereavement facilitator, if there's some stuff going on that's more indicative of depression. And by that I mean way too much partying, sleeping around, grades dropping, getting fixated on death, eating too much, all of those sorts of acting out or self punishing behaviors, anything that looks like what would commonly be described as depression. But when it gets too settled in, it's too strong, you need some help. So give me a call, 310 625 6083. I look forward to speaking with you.